Hey everyone, how are you? Brian, good to see you. Welcome, all dressed up. Um, Thanks for joining, as always. Let's dive in here. We have 1,848 cases and 75 fatalities. That's 1,848. I have a couple quick updates and then I'm gonna hand it over to other folks. The drop-in facility had yesterday 9 clients use it. And we're working to get the word out about the facility and anticipate that number to increase. But we're happy that there's been no issues and the people have been using the service already. Thanks again to the many organizations that have made that possible. Career High School has 6 people, according to our report this morning. And let me hand it over to Director Bond for any updates that she has.
Thank you, Mayor. So yesterday, there was a question raised about the total electronic lab reports that we have on file. So we wanted to report that out today. To date, we have 6,845 electronic lab records, of which 32% are positive and 68% are negative. Our nursing home data, currently we have a total of 77 residents, of which 20 are within the facility, 49 have recovered, 1 hospitalized, and 4 discharged to go home. And we've had 2 untimely deaths in the hospital, and then an additional untimely death within the facility. A staff total of 22 positive cases. And to date, the difference in the report is that they have taken in 20 positive cases patients from area hospitals and assisted living facilities. And the highlight is we have 1 positive resident and 1 discharge. For Mary Wade, we have the Boardman residential. We had a total of 18 residents, of which 12 are now within the skilled nursing facility side. And we have 4 that are hospitalized, 2 untimely deaths. The Kimberly Skilled Nursing Facility, they have a total of 33 positive COVID-19 residents. They are 15 COVID positive, 12 of which were transferred from Boardman, as I mentioned. 3 are hospitalized. We've had 10 untimely deaths within the skilled nursing facility, and deaths in the hospital were 5. Staff total are 33 COVID positive, of which 8 are non-clinical. And so the difference in my previous report is we've had 1 more positive that has been hospitalized, and we're waiting for other test results to come in. For Regal Care, to date, we have a total of 35 residents, of which 25 are within the facility, 4 are hospitalized, 2 discharged to go home, 1 untimely death, and 3 untimely deaths within the hospital. We have a staff total of 15 that have tested positive, and the difference between my prior report is that 3 additional positive residents since the beginning of my report the other day. Advanced Nursing is the other facility that we're closely monitoring as well. We have a total of 37 positive cases within the facility, is 21. 14 are hospitalized, 2 untimely deaths. We have a total of 12 employees that are tested positive. And the highlight in the difference between my prior report is 2 or more residents have tested positive. They are cohorting into different units. And the Department of Public Health did conduct a site visit today with the National Guard. That concludes my report.
Thanks. That was a lot to take in, Director Bond.
I'm sorry. You told me to be deep.
I appreciate the work that you put in there. So New Haven Public Schools, I wanted to note that your team, Mike Pinto, has distributed more than 200,000 meals so far. Can you give some more exact numbers there?
Sure. We, as of yesterday, when yesterday was our Wednesday, we had done a total of 253,953. Yesterday we did 3,756 for breakfast and also 3,756 for lunch. As we've gone through over the course of March totals, we did 55,636. Obviously, that was a slightly shorter month. We did 156,143 in April, and so far our May to date is 42,000. And as I said, our total for the 3 months since we started is 253,953.
That's amazing. Congratulations on the work there. Passing the 250,000 meals milestone is impressive. Thanks for all that. Just a thought, Director Bond, would you be willing in the future to like share a slide that outlines those numbers so it's a little bit easier for the press on the nursing homes to digest that?
Actually, we just privately chatted about that, Gage and I.
Oh, no way.
Yeah, we did.
Awesome. That's great.
Great minds think alike.
So that'll make it a little bit easier. And then Chief Reyes. So Chief had I think the first CompStat, a Zoom CompStat, which I joined this morning, and I thought it was really important to share some of the slides that the Chief shared this morning, in case some of the press hadn't seen those. So I'd love to take just a couple of minutes, Chief, if you can go through those slides, and I will share my screen so you can see them here. Because I think the numbers are quite interesting, and overall the graphic is very telling about the state of crime in the city.
Yeah, thank you, Mayor. And so today, as the mayor said, we had our first CompStat really since the pandemic started. And I think it was very successful, albeit it was long. I think we covered a lot of critical information, just sort of giving an introspective of what life has been through the lens of the police department as we navigate through this pandemic, and no more obvious sort of report card on that than the stats. And so what you have in front of you is what I'm sure you're all familiar with, is what we provide on a weekly basis to our CompStat goers, and obviously it's posted on our website every week. It gives you a sense of year to date what our numbers are, and as you can see, and I won't go into every detail because we have several slides the mayor wants me to cover, but I will say that overall, if you look at it's divided into violent crime, property crime, and then sort of the all-encompassing other crimes that can be sort of proactive or sort of calls for service. So the most important number, obviously, being violent crime in terms of safety, almost 28% reduction year to date. And then you see the property crime, we're down just a modest 3.4%. And all the other sort of general crimes we're down 15%. Our motor vehicle stops, as you see, the year-to-date stops are up slightly. Excuse me one second. Just want to make sure I'm reporting that accurately. Yep, our motor vehicle stops are up from last year at this time. But for us, we started a real strong effort with motor vehicle stops in the beginning of the year. It was one of the real first priorities of the mayor in terms of pedestrian safety and really just motor vehicle enforcement. So that was something we started off really strong in the year, and obviously we had to taper that off with the COVID pandemic. Our confirmed shots fired, you'll notice there's an increase, and that's attributed largely to added sensors that we blanketed all of Fairhaven with. And so the more sensors you have, the more reports you're going to have. So in upcoming years, we'll be able to have a better sort of comparison year to year on how we're trending in terms of shots fired. I like to just say that I don't have the specific year-to-date stats, but I can tell you that our comparable cities around the state are in the hundreds. And so we're very, even though we have a modest gain, we feel pretty good about the the sort of the trend that we have in terms of our shots fired. Next slide, please.
I'm realizing that it's not letting me forward the slide. So let's see what I can do here. Hang on, everybody.
Just going to move a second because I got to get to it.
Hang on. We might have to do this a different way. I think we're going to have to do it this way, if that's all right with you, Chief.
Oh, of course. And so this is just, I had our analysts put together just some of these slides to really inform us all of what in real terms and, you know, the pandemic has, the impact the pandemic has had. That dotted line represents, you know, that week 11 in the year, sort of when we really started getting, feeling the impact of COVID. That's when it happened. So when you look at this slide, our calls for service, not surprisingly, went down. And so you see that represented week to week there. Definitely felt the impact of seeing less calls for service post-pandemic. This slide is our number of arrests. And this is, again, a catch-all sort of slide. Doesn't have it broken down in this particular slide, but just to, again, get an idea, there's a lot of, you know, just sort of intrigue and a lot of concern about what the COVID pandemic has had in terms of our enforcement. This is just, I mean, remember, these are arrests, again, that represent both proactive and the results of a reactive work that we do in terms of calls for service. As you can see, a significant reduction in arrest post-pandemic. That was calls for service. And the domestic calls are really particularly interesting because obviously we were all very interested in seeing and tracking what the domestic calls would look like, considering that people would be obviously quarantined at home, self-quarantining, or isolating at home, or just obviously following governors and mayoral mandates to stay home. And so we were concerned that that was going to translate into more domestic calls. I think the numbers certainly for New Haven are, you know, tell a different story, a dramatic decrease in domestic calls. And in the next slide, we have it broken down into, I'm sorry, I thought the arrest came next. Oh, I'm sorry, these are the domestic calls that resulted in arrest. So if you notice a significant decrease in the number of domestic arrests that occurred during that period of time.
Maybe, did I skip a slide here? Yeah. So this is
Yeah,
domestic dispute. Sorry about that.
There it is. No worries. And so this is the one showing, so we're pretty flat in terms of our response. You see after week 13, there is a modest decline in the number of domestic calls. I mean, modest being somewhere around 10, you know, on an average, which is still pretty significant, but not compared to the number of arrests as you saw on the next slide. And so you might ask yourself, well, same amount of calls, why is such a decrease in arrests? And so part of that can be attributed to the whole criminal justice system, not just the police department. Obviously, modification of services over at court, and they had limited staff. They had modified court dates. And so we were many times issuing misdemeanors. Many times we were taking alternative actions other than arrests for these calls. So therefore they were resulting in less custodial arrests. And not to mention including the internal policies that had an impact on those numbers. This is a slide showing you the year-to-date collisions. Again, not surprising. There are less people on the road, less people rushing to work, less people going to work. And so pretty clearly shows here the impact of COVID on the city of New Haven in terms of collisions during the past couple of months. And another thing that people have been particularly interested about, I get, you know, periodically I get either calls or emails about, people frustrated with the level of enforcement. And here you see that our enforcement, the motor vehicle stops, and usually these are most of our motor vehicle stops are obviously proactive work. And this is a direct result of policy changes. In order to keep the public safe and in order to reduce first responder exposures, we created policies where we did not do as much proactive work on these lower offenses, like turning on red and things of that nature. We're still doing enforcement on people taking, engaging in reckless motor vehicle operation. But the lower level crimes obviously are not getting the same attention as they used to pre-COVID.
And of course, there's a lot fewer people driving right now.
And then there's a lot of people not driving, correct, Mayor? These are our aggravated assault numbers. And basically we track the assaults in the city. Obviously that's part of our violent crime stats. And you can see a major reduction in aggravated assaults during the period. Pre-COVID, we were pretty consistent with last year's number. Post-COVID, definitely a big decrease. Our robbery numbers initially, we saw not just with our robbery numbers, like the first or second week of COVID, we actually saw a spike in our shootings. There was one week we had 5, and we had pretty much gotten a handle where we were not seeing as many shootings in the city. And so that was alarming to us, and we were concerned about what that was going to mean long term. But we were able to really get that under wraps. Robbery is another indication for us because, again, it gives us a report card on how violent crime is doing in the city. Robberies can turn violent. Robberies are a violent crime, and so we had a spike in robberies compared to last year in the beginning few weeks of COVID. We put some efforts in place as well. We targeted several people. We did some targeted enforcement. This was a group attributed largely that second week to a youth group that was going around doing just stealing cars and doing robberies. We identified them. We worked with some partners. We did some unconventional behind the scenes work and really got a hold of that. And so in the upcoming weeks after that, we definitely see a decline. Confirmed gunshots, just again illustrating what I spoke about earlier in terms of the gunshots. We saw an initial spike again. That second week, we saw some activity. A lot of our efforts focused on reducing gun violence in the city, certainly depicted here that it paid off. Motor vehicle thefts, again, just giving you a sense. We were concerned about these Part B crimes because, again, people are not working. There's more people out. We didn't know how that was going to translate in terms of our numbers. Again, you see a trend here, week 12, week 13, from week 12 to 13, there was a spike compared to the previous year. And we were able to get that, under wraps. Same thing with larceny from vehicles. It's pretty much the same point there in our burglaries. These are all what we call our Part B crimes. These are when we talk about burglaries, this is a catch-all. These are not necessarily, these are more, the lion's share of these are non-occupied dwellings. And the same for larceny, sir. I think the rest of the slides kind of go into each district. So I think, the picture, the overall, I think, is that we're very happy to report that amid all the challenges and even the changing and sort of the policy changes within the city, throughout the city and every department, not to mention the police department, we have been able to keep crime down, and we've been able to put some efforts. One thing I do want to say is we have one officer that's currently out. We've had up to 82 people during this time frame that were impacted directly or indirectly by COVID. Every single person, all but one, has returned to work. And as of the 11th, we will be, that list will be dwindled down to 0. We're very, very happy about that. And I've said it before, I say again, that's a collaborative effort, not just, that was really us informing ourselves, learning about what we didn't know and how to better protect our department. And I want to say thank you to everyone, particularly Director Bond for her guidance and wisdom in helping us achieve that.
Thanks, Chief. Nice work. Appreciate the report. It's helpful to see it graphically. It really it sums it up quite well.
Thank you.
Mike Pinsel had something more to add, and then we can hand it over to questions.
Sure. Thank you again, Mayor. Dr. Tracy just, she wasn't able to join us today, but she wanted me to share with you one of the, in order to keep kids, keep our students and our kids engaged and to reconnect them in some ways with their teachers, we are going to do a series of reverse parades where the teachers and administrators will be at the schools. We're doing, looks like we're doing 3 of them tomorrow, Celentano at 9:30, Barnard and Jepson. And so again, it'll be a drive-by parade so that if the teachers and administrators will be able to wave to their students as they drive by. Just a way to try to keep kids engaged and also to keep the connection between teachers and their students who were sort of very abruptly sort of pulled apart back in March. So we're hoping we were able to do one at Truman that went very well yesterday, and we're working again to keep our kids engaged and keep reconnect teachers and students, and we think those will be terrific. Again, so tomorrow will be Celentano at 9:30, Barnard at 11 o'clock, and then Jepson at 12. That's the extent of it. So thank you, appreciate it.
Thanks, Mike. My daughter's school at Columbus is going to do the same thing tomorrow. The teachers are going to do that as well in the afternoon. So we're looking forward to that. Let's open it up to questions. Go ahead, Tom.
Thanks. And well, since Mr. Pinto just presented, just so I understand, teachers and administrators will be in person at the school, and then students and families can drive by and wave. Is that what's happening?
Yeah, that's the idea. Yep.
Okay, thanks. And thank you very much for the presentation.
Just a clarification, in my daughter's school, the teachers are driving around, I believe. So it sounds like it's not one size fits all, but anyhow.
Okay. And thanks for the presentation, Chief Reyes. That was very helpful. I want to ask about one of the first slides you showed about how overall calls for service seem to be down by quite a bit, especially soon after the start of the pandemic. And in virtual town halls that the hospital has hosted on a somewhat regular basis, they've spoken a lot about encouraging people who are, who have heart conditions and strokes and other non-COVID related serious concerns to make sure to keep calling the hospital and seeing their doctor, despite concerns about hospitals having lots of people with COVID in them. And so I wonder if you are concerned about people not calling the police when they do need your help, and if they're in a very serious situation. Is that something that you or your officers have been thinking about? And if so, what do you say to the general public about when is an appropriate time to call the police during this pandemic and when is not an appropriate time?
It's a really good question, Tom. What I will say is that much of our focus in terms of our post-COVID response and modification of our services was geared towards our response, not sending a message to the public about modifying their actions. And what I mean with that is that we wanted people to understand that even though our services were being modified in whatever fashion, that we were still, they could still expect that the police was going to respond. We didn't stop going to calls. We just changed the way we approached those calls or responded to those calls. If a call did not require face-to-face, it could be done over the phone. Then those people were hearing, those complainants were getting a call directly from the officer. So it was very important for people not to feel a disconnect during this uncertainty with their police department, right? I mean, everyone is going to call on their public safety personnel during these times, and we didn't want to send a message that, nope, we're closed for business. It was just, our message was, our doors are closed for certain things. You can't come to the PD, but we can go to you. We were very concerned about making sure we did not confuse the public. And so we're surprised that the numbers are down. I can't say, Tom, what that's attributed to, but I'm happy to say I think we've done a very good job of making sure the community feels that we're still responsive and that we haven't closed for business, that we're still available to them and accessible to them. We're just doing it in a safer way.
I think to add to what the chief said, of course, if there are issues, people should always be calling the police. If it's an absolute emergency, they should be calling 911. If not, they should be calling the non-emergency line. It's a little bit hard to know exactly why the calls are down from last year, but I would speculate that this is a little bit of a different scenario than what you're seeing at the hospital because, and this is speculation, but I would imagine the public is not as afraid to call the police to report an issue because they're less likely to have to physically interact with the police. Whereas what we were seeing with the hospital is a likelihood that the public may be afraid to go to the hospital because they are afraid that they would get COVID. And the hospital, some of the leadership at the hospital had said that they thought they were concerned that the public might be afraid to reach out and get services because they felt the hospital was unsafe. My sense is that this is a different scenario. And again, it's hard to know exactly why. It could be that people are less active, so they're just not getting into as many engagements. Maybe they're not, they're not going out as much, so there's less likelihood of people needing the police is my hope, rather than people are actually because of COVID more fearful of calling the police for help.
And I think intentionally this was a slide that was meant to be sort of an overview of all calls for service. I suspect that if we broke it down into the types of calls, it would give us a better understanding of what the impact truly was. Remember, calls for service can be motor vehicle accidents. I'm calling because I got into an accident. So we saw a reduced number of motor vehicle accidents, right? Well, those are fewer calls for service. I think, reading too much into this without having, more of a breakdown might be miscategorizing it.
Understood. Thank you for that. And Chief, I wanted to ask you as well if you could give an example of an alternative action to arrest that an officer might engage in on a domestic call. You said that domestic calls themselves are not necessarily down too much, but domestic calls that lead to arrests are down pretty significantly. So what's an example or two of something an officer might do on a domestic call that doesn't result in arrest?
And I meant custodial arrest for sure. And so on the lower level calls, your breach of peace, disorderly conduct type calls that are someone having an argument at home, where in the past, we might be more inclined, again, depending on the dynamic, to do a custodial arrest to sort of mitigate that issue. Because of the fact that we're working closely with our criminal justice partners, they've asked us to reduce the influx of people because the courts simply can't handle it with their modified services. We were issuing summons, and some of these summons were post-dated beyond the required time frame, depending on what the courts were saying. But so what I meant with that is that we were doing fewer custodial arrests, and more often than not, we would ask someone to leave, make sure that they left, make sure we made arrangements for them to go and stay elsewhere. Whereas maybe in the past, we would have just done a custodial arrest just to mitigate that. So I think that was the biggest change to the way we did business, is more misdemeanor summonses and more maybe making alternative arrangements for stay rather than custodial arrests.
Thank you for that again. And I do have several more questions. Maybe I'll just do one more for the mayor, and then I'm happy to defer to others for a bit. But Mayor, yesterday, U.S. District Court Judge Bond Arterton ruled against the state in the state's bid to dismiss a lawsuit filed by the state ACLU. It's calling for the Department of Correction to release more inmates who are medically vulnerable and over 50 years old, I believe, and also come up with a more concrete plan to protect them. And I know I've asked about this in weeks past, but since this is a situation that I imagine will be evolving as long as the pandemic's happening, what's your response to this kind of latest decision in the ACLU versus state bid around how best to protect inmates? And what are your feelings as of today as to what the proper approach is for the state to best protect both communities and people incarcerated during this pandemic?
I think that it's, inmates are still people, right? And it's important for us to, in similar to how we might approach a nursing home, make sure that we're in as many ways as possible keeping people safe. I know that the chief has worked very hard to reduce the number of people that we see in our lockup facility and been quite successful in that. I do think that it's appropriate for lower level crimes to release people that are nonviolent crimes, and also appropriate for the Department of Corrections to make sure they're doing everything possible to separate people out, and so that they're kept as safe as possible. I don't agree that we should go so far as to release everyone from prison, like some advocacy groups are pushing. I think that's too far, and we need to make sure that we're keeping members of the public safe. And I think that we've worked very hard in New Haven to be on the front end of this, and the average numbers of people in our lockup facility has dramatically decreased because of this.
Thanks. I'm happy to defer to others for a bit.
So let's go to Michael Bingham, and then we can go to Shana. Or I'm sorry, Kyle, and then Shana, because Kyle's had her hand up for a while. But go ahead, Michael.
Oh, thank you. Good afternoon. It was I who asked the question yesterday about numbers of tests that had been performed at the 5 testing facilities. And Mr. Mayor, at the beginning of the call, you had said you were talking about number of tests performed at the drop-in facility. Were you talking about Chapel Street yesterday?
No, so the drop-in facility is there were not 9 tests conducted there. The drop-in facility is the Blakefield facility that we have set up to help support individuals experiencing homelessness.
And then, I shared cumulative numbers for all testing sites. All testing facilities. We are trying to stratify the 5 specific testing sites and are working on that, and we'll have that at a later date. This is more cumulative of all the testing facilities because what happens is we get them through an electronic laboratory record. So that's what I reported earlier.
Thank you for the clarification on that. One of the reasons I brought that up is I visited all the sites recently, and in personal observation, the last few days, traffic has been very light. At the Chapel Street site yesterday, I was there a number of times, and there's basically nobody getting tested there, except 2 people who were on this call got tested there yesterday. And I'm wondering if either we have somehow an overcapacity of testing, or that not enough people know that they can go, for instance, to the drop-in site at Chapel Street and get tested, even if they don't have a doctor's referral, if they're asymptomatic, and not enough people know because, if people are sick and they don't know they can get a test and therefore get treatment, that's bad.
So yesterday we put out, I think the day before yesterday, we put out a robocall within a mile radius. The mayor announced that. We've also promoted it through social media. We've been, increasing our efforts so that people know about the testing site on Dade and Chapel in particular. And then we also have been asking community partners to share the link of the 5 testing sites that we have throughout the city. And so I, and then yesterday, I think I made a comment as well. If you all can then share that link as well within your respective social media platforms, I think it takes increasing the messaging as a community. We can make sure that people are aware that this is an option for them. But we do need, we do recognize that we have to market all of the sites as they're not all testing within their capacity.
Right.
I think also, Michael, so I think it's in part a challenge of getting the word out about these testing sites, but it's also in part a transition from testing symptomatic people to asymptomatic people. And there will be some growing pains in that, because all along the testing has been quite limited. And as we increase our capacity, we'll increase the types of people that we are interested in testing, and also need to get the message out to people that they should be tested. Previously, all we were saying is, if you're symptomatic, get tested. If you're symptomatic, get tested. And now we will start to be stepping into a different type of testing regime. And I think that will, the need is there. I don't want anyone to think that we've reached our capacity as far as testing goes.
Yeah, we did. We certainly have not. We've done an assessment of that, and in fact, we need to expand further, and we're trying to provide them right within the community so people can walk up. Yes, on an average, we're testing about 25 to 30 people at the Date and Chapel site. I will confirm our daily number for the week, and it's important. Maybe there was some light traffic time when Tom and others went to get tested, and I'm glad it was I like the article. Thank you, Tom, for publishing that article and sharing your experience, because I've had a few people say to me that they were afraid to get tested because they didn't want the swab inside their nose and the fear that it was hurting. So the fact that you shared that it was actually ticklish, it was nice for you to share that perspective. And so one of the things that we also want to encourage people, if they have any difficulty with scheduling a test, they need assistance with either the CVS site testing or the Day and Chapel testing site. Our hotline is available for people to schedule testing at 203-946-4949. So our public health nurses are available to assist with scheduling testing.
Well, thank you for the clarification on that, but it seems to make sense to let people know that they can go there and get tested even if they're asymptomatic, because you don't want to waste capacity during a medical emergency, right?
That's right. And we also, yeah, exactly. And they don't have to if they're not able to make an appointment, we are taking registration on site at the Day and Chapel Street location.
Thank you for the clarification. Mr. Breen, I didn't like that thing going down my nose any more than you did. So
I love that photo. It's such a great photo.
thank you.
Thanks, Michael.
Thanks.
Kyle, go ahead.
Just trying to get this. Oh, there we go. I was just trying to get the screen to record. We were trying something new here. I have a couple questions regarding the crime data. Thank you very much for making that available. The first question is, would those slides be sent out after the presentation just so we can review them ourselves?
Chief, you okay with that?
Absolutely.
Okay, great. Thank you.
We'll have Gage send those out.
Great. So we were looking at some of this data before, and it looks like the downtown area crime is down. It's like 60, almost 62%. It looks like obviously that's because fewer people are downtown. I just wanted to see if our assumption was correct with that one.
Yeah, I mean, I think that's spot on. I mean, it's certainly one of the districts that's seen the most significant decline of people in terms of the number of people that frequent it. So yeah, I think that's a good assumption.
Okay, and yesterday we were asking Director Bond about the C-click fix, and a lot of there was a large number of reports for gatherings, and I was just wondering if that's something that the police department responds to, if you get calls for under COVID-19 for gatherings and things like that.
Yeah, and I think our goal collectively with the mayor's guidance is what we've been very careful not to criminalize, right, the social the violations of social distancing. And so what we've been doing is, yes, we've been responding. We've been playing PSAs over the loudspeakers. We've been engaging people through our district managers and through our stakeholders within the communities, our civic leaders, really trying to send the message in a positive way and not try to criminalize this. But at the end of the day, these are governmental orders, and this is a public safety concern. And so we do reserve the right to enforce these orders if people aren't willing to comply. But our message is that, listen, we're in this together. The police department is here to help keep people safe. We're looking to do that in a way that's not escalated, and we're certainly not. We all saw what happened in New York over the past few days, right? And certainly me as a police chief, I look at that, trust me when I tell you, I've had conversations with other police chiefs, and that's not the narrative. And again, I'm not we have a very limited perspective on what happened in New York, but certainly the optics of that, right, has a negative impact and resonates negatively in the community. So we've done a lot of work in New Haven to collectively, not just the police department, to prevent those types of outcomes. We certainly don't want the COVID-19 efforts to derail all of that. So we're using those relationships, and our goal is we are enforcing, but we're doing things in a de-escalated way, and we're doing it in a constructive way.
Okay. And then one last question for right now. I might have another one later. When you see that the crime has decreased, and that's, again, obviously the assumption is people are staying home, but does that free up you all to use resources in other ways? I know that there was a big announcement of the enforcement for ATVs. I'm assuming that would be an effort otherwise, but does this crime decrease give you guys more time to do other activities like the ATV and biking?
Well, I mean, the short answer is yes, but I will say that the decrease in crime, remember, there's work that's done proactively to achieve that. And so that doesn't mean that the officers are not doing work, and it doesn't mean that we have less to do. It just means that the things that we're doing are paying dividends. And obviously that added to the fact that there's certain dynamics that the COVID-19 pandemic has, that we're seeing in terms of, again, less people on the street, and crime numbers are going to come down as a result of that. But I think there's a lot of work that we're doing behind the scenes. And even some stuff that's not traditional police work, right? That's helped those numbers come down. And we're also playing a lot of supportive roles to many others within the city, because that's what we're being called to do right now. So that's what the team is doing right now. It's not just traditional police work. We're doing whatever we're called upon to do.
Great.
I just wanted to add on the enforcement of social distancing and mask wearing. Overwhelmingly, people have been following these guidelines, and there are anomalies from time to time where the police department, I think, has been quite good at engaging in a way that's productive. People also have been quite good at dispersing if there's a large group together, and I do think it's important for us to acknowledge and thank the New Haven residents from all around the city for working really hard to follow the guidelines. It's not easy, and oftentimes these anomalies get a lot more attention, but the vast majority of people are really doing the right thing.
Mayor, I want to echo that. I'm glad you made that point. And the times that we have had to go do enforcement, I can't think of, and if there are, that's been very, very few and far between, where people haven't been compliant. So you're absolutely right, Mayor. I think people are receptive to it, and I don't think the officers have had a negative sort of experience in enforcing these orders overall.
Thanks, Chief. Sheena, go ahead.
Thank you, Mayor. I wanted to follow up on my questions from yesterday regarding testing in urban communities. I know you and Director Bond have worked extensively to release the latest stats as far as where the city lies, where the hotspots are. And I know yesterday you had mentioned that those hotspots are going to be key in identifying potential next testing sites in New Haven neighborhoods. And the governor as well has been talking about urban communities in as far as where the testing capacity is for that. I wonder what your communication has been like with the state as far as the hotspots and how you plan to kind of address the hotspots within your own neighborhoods.
I don't yet have a ton of details, other than I know that the state is very anxious to increase the number of tests provided, and is particularly concerned about supporting urban centers where there's obviously many more cases than suburban areas. And I know that our team, and in particular Director Bond, is working very hard to identify additional options. In addition to just the capacity question of getting more tests available, there's a lot of changing dynamics with the availability of tests that is overall a good thing to give us more options. I anticipate that in over the coming days we'll have new announcements about the directions we're heading on testing. But I think that one of the keys that we've realized, and it's also related to Michael Bingham's question, is that having some flexibility about moving around testing sites is important because we need to bring testing to people in addition to having sites where people know they can go if they need to. And so that, that may be setting up sites in different neighborhoods for just a short period of time. It may be going to nursing homes or other dense residential buildings periodically, where we realize that we need to be flexible about how we test. And that's one of the things that we're exploring.
Gotcha. One more thing that the governor had mentioned today in his briefing was he would be signing an executive order on Connecticut residents not needing any form of doctor's permission to get tested anymore. Obviously removing a major barrier that at the beginning was very real for a lot of people in the neighborhoods that we're referring to, those without a primary care physician or let alone insurance. So I'm wondering, now that that executive order should be in place, what is the city's reaction to that, and kind of how do you kind of believe you could move forward as far as getting people to get tested in these hard hit communities?
So
Yeah,
I can answer.
I can take a
answer them.
stab, and then
You
you can take a stab. You want?
Yep.
So in New Haven, we've really never had that barrier. Technically, Yale New Haven Hospital is the only site that requires a doctor's orders, but our health department, very quickly after Yale New Haven Hospital stood up that site, offered our services to provide prescriptions to people and do an assessment of whether or not people needed a test because they were symptomatic. And so pretty quickly we addressed that challenge. I presume that it's a challenge in many other communities around Connecticut. And so overall, we very early on said this is the right thing to do, is to lower the barriers to people getting tested. I'm glad that the governor's taking that step to make sure that more people can get tested. We still have concerns about, for example, the undocumented population. The CVS site still requires a Connecticut ID in order to utilize the site. And obviously, if there are people living in our state, regardless of who they are, what they look like, how much money they have, they can get impacted by this virus and they can spread this virus to other people. So we need to make sure that all sites are accessible to all people. Director Bond, I don't know if you want anything to have anything.
No, that was perfect. Thank you.
Okay.
I guess my final question, there's a federal grant, from what I understand, that the governor had talked about to help, quote unquote, disadvantaged communities. Is New Haven in contact with that fund? And kind of tell me, if you can, give me an idea of where that would go, given the amount of hotspots that you guys just released this week.
I'm not clear what grant specifically was referred to. There are a number of different pools of money that have already been granted to the city, and other pools of money that we are seeking out. I can say with quite a lot of certainty that municipalities like New Haven are facing, the whole country is facing economic challenges. Municipalities like New Haven are facing a particular economic challenge because on two fronts, we were already having severe budget problems because of the inequities in our governmental system in Connecticut that disproportionately impact and hamper municipalities. But the second is that our populations were already economically challenged, but COVID-19 has clearly had a much more severe impact, in particular on Black and Brown communities in cities like New Haven. And so it is my hope and my expectation that leaders in Washington will advocate for and ensure cities like New Haven get the funding that we need to make sure that we are starting to turn this crisis around and make it not a crisis that further exacerbates income inequality, but rather turns this crisis into an opportunity where we can start to undo some of those wrongs.
Yeah, and I just want to add that, there are different funding streams, like the mayor indicated. Are you referring to the $7.5 million grant that he announced earlier today?
Yes, I am.
Okay, so that is to expand testing, I believe, to federally qualified health centers. That was announced, I believe, earlier today. So we are going to look into that to determine whether local health can apply for that funding. But if federally qualified centers, it's expanding to them in particular, that would be great, because those are two collaborative partners that we're working closely with in for testing in the community. So.
I'm not sure if it's the same pool of money, but I know Fairhaven Health was awarded, I believe it's $350,000 to help support their efforts around telemedicine and other efforts around COVID-19. They've been just an incredible partner through this crisis, and I'm very, very happy to hear that that's been acknowledged.
I guess to my follow-up to my point, because you had mentioned before that making obviously the testing accessible to residents in New Haven is obviously important. And I know that the Long Wharf site has been a huge help in getting people tested. But Mayor Elicker, you mentioned a good point about, people being more apt to get tested if they can walk to their site versus having to take a ride or whatever. I know Hartford has had some programs where they will offer free rides. And I think you alluded to that as well. So does that still stand?
Yes, so people that wish to get tested can either walk to one of the sites, or they can call, if they need to get a ride to the CVS site, they sign up for an appointment, and then they can call 211 and get a free taxi service through M7 to the site and back from the site. And the taxi service can also support people that have disabilities or in wheelchairs. So there's really no barrier to people getting tested in New Haven, other than people taking their own initiative, and that's not something that you always take for granted either. But we've worked very hard to eliminate as many barriers as possible to people accessing testing.
Thank you, Mayor.
Yep. Any other questions? Go ahead, Tom.
Thank you. I'll be quick. I know there's been quite a bit of reporting about just a huge spike in opioid overdoses in Ohio, Dayton and Columbus, and I'm sure this is happening all over the country. I don't know if you or Director Bond or Chief Reyes, this may be something best for Dr. Dalal, but do you know if New Haven has seen any kind of increase in what was recognized as the pandemic we were facing before this pandemic started, the kind of opioid pandemic?
Yeah. So we are looking at that, and we've been looking at some reports, and so we can report on that formally on another day of the press conference, but that's still on our radar. And so Dr. Dalal and I looked at our most recent report and are monitoring that closely. Fire and I think police also monitors opioid overdoses in the city as well. And so, we want to make sure that stays a priority. And it's definitely in our forefront when we're thinking about many things. And COVID-19 has taken a precedent, but opioid is still a priority for us.
Thanks. Yeah, I'd love to circle back to that at some future meeting. But
yeah, absolutely.
Chief, do you have something to add there? I saw you on mute.
Just wanted to say that without having any stats readily available, we do track, as Director Bond said, we do track that as well at the police department. It's something that we keep a finger on that pulse, and we have not seen any significant trends whatsoever on that. Again, that's without having the benefit of the stats in front of me, but it's not something that has been that there's been any alarming trends to report on.
thank you very much for that. And then on a somewhat related matter, I recently spoke with Beatrice Codiani of Sex Workers and Allies Network, who I think you all are familiar with. And she often works with people at the intersection of Grand Avenue and Ferry Street. It's a pretty popular spot for people engaged in sex workers, for homeless people, for people who use drugs. And she was really advocating for porta potties set up there, some kind of triage center similar to what you all have recently set up in Blakefield, considering how much of a hotspot that is pre-pandemic for very vulnerable populations. Is that something either Mayor, Director Bond, or Chief Reyes that you all are considering? And any other comments on that particular part of Fairhaven that has been a focus in months and years past?
So I'm not aware that they've made the specific request to the city, but it's highly possible that they have, because I know Dr. Talal has been in a lot of communication with SWAN, and that they are one of the organizations that is helping support the drop-in site at Blake Field. At the moment, we're not considering an additional drop-in site. It took an incredible amount of work to set that up. And one of the limitations is staffing. It's difficult for us to set up drop-in sites all around the city. But it's something that I'm happy to talk with Dr. Dalal about. And, we want to make sure that we're helping as many people as possible, and doing that in the most effective way.
That's it for me. Thanks.
Go on, Brian.
Thank you. I have a question for Chief Reyes. You've been talking about how things like custodial arrests are down because of the way the operations are working. Is that something that you think can be sustained once the pandemic has passed?
You're on mute, Chief. There you go.
I think we certainly don't strive to make arrests, and so anything that we can implement, anything we've learned from the policies we've created throughout the pandemic that are worth sustaining, we will consider. Many of the changes to our custodial arrests for domestic violence, those are predetermined type of arrests. In other words, those are state mandated arrests. We made changes to that based on changes within the criminal justice system and their requirements. In terms of our daily arrests for other non-domestic violence related crimes, again, we don't strive to make arrests. We actually strive not to have to make arrests and diffuse situations as much as possible. I like to believe that most of, if not all of, our custodial arrests are necessary. But in short, I think if there's anything we can learn in terms of policy and sustained efforts, when this is all behind us, when that day ever comes, we certainly will implement that, because our goal is to make fewer arrests.
Thank you.
Can we go to Kyle for the last question?
Thank you very much for that. The last question, I know it's similar to that was just asked. I know you mentioned that other police work in addition to COVID-19 has helped reduce crime. What is your vision, or what do you anticipate once things start to reopen around the 20th and into the summer, when typically I believe crimes tend to go up around the summertime? How do you see this sustaining?
Yeah, another great question. We always, we always put a lot of effort into summer anti-violence, certainly summer anti-violence initiatives. People are out more. Things like ATV, quality of life issues, tend to spike during the summer. And so, for example, with ATV enforcement, the mayor's been very clear he wants this to be a sustained effort, and I agree with him 100%. I think you can see from the response to the weekend's efforts on the ATV enforcement that it's something that is very important to the community, and more importantly, it's something that's plaguing the community, because the response was pretty overwhelming. And so, one of our goals, for example, in that particular crime, is that we're going to have a sustained effort throughout the summer to send a message and also to prevent those types of crimes from continuing. So, yeah, I mean, this time of year, we're planning for the summer, and there are a lot of things that are not going to happen as a result of COVID-19, right? You're going to have less people at establishments like bars and things like that, where that can tend to be the cause of some issues. But we're anticipating, we're always preparing for the worst and hoping for the best. And so we're looking at what we've been trending during these last couple of months with COVID, and letting that inform us in terms of what's next for the summer. But right now we're taking it week by week, day by day. but planning month by month, and so that we're ready for whatever comes.
I'd also add to that, I would say that it's a concern because it's unlikely that we're going to this summer be able to do things in a normal way. And typically, New Haven has a lot of support for young people over the summer. That's summer jobs, that's summer camps, and that's street outreach workers that are actually out on the street engaging face to face with people. And while it's likely that some of those activities will happen, I'm not sure we're going to be able to do this in a way that we typically do over the summer. This is something that we're going to keep our eye on and work to make sure that we're doing everything we can to reduce the likelihood of people getting into trouble. But it is a concern. I think it's important for us to be straightforward about that. That we have a lot of work to do. I have a lot of confidence in our police department, who I think has shown that they are quite capable of addressing these many issues and responding and being quite flexible. But it's something that is definitely on my mind.
All right, thank you.
Thank you. Thanks as always, everyone, and we will see you very soon.